Cornwall Hospice Care is supporting our healthcare colleagues in all settings throughout Cornwall 24/7 with our specialist palliative care advice line. I'm Dr. Carolyn Campbell. I'm a consultant in palliative care at Cornwall Hospice Care. We've run a 24-hour advice line from the hospice now for over 7 years, and that runs all day, every day through the year. And that takes between 700 and 800 calls a year, so a lot. And those calls come in from our colleagues in general practice, the out-of-hours service, the acute hospital trust, nursing homes, community hospitals, anywhere that patients are in Cornwall. So most people who phone the advice line are dealing with patients with difficult symptoms or who are nearing the end of their lives, and those patients can be anywhere in Cornwall. So this is how they access our specialist advice, in many cases then hopefully without having to move those patients, because we know that for most people when they're unwell or in pain, the last thing they want is to be moved somewhere else if they don't have to. So what the advice line does is supports professionals to look after patients where they are. So a huge proportion of our calls are from GPs, both patients' own GPs and the out-of-hours GPs, and they'll phone us up to talk through, I've got a patient with difficult pain or difficult nausea or breathlessness, and I've tried this and it's not working, what can I try next? Very often, especially the out-of-hours services, will phone us to say, look, I've just met this patient, I'm not sure whether they need to go into hospital or come into you, or whether I can manage the situation at home, and we can help them work out what the best option is for that patient. We also provide the acute hospital's only out-of-hours palliative care service, so we're providing advice to junior doctors and nurses on the wards at Trelisk and West Cornwall, out of hours and at the weekend. We've actually never received external funding for the advice line. This is a service that supports patients in every setting in Cornwall: home, nursing home, community hospitals, acute hospitals, and there's no dedicated funding for that. The service is provided, so the calls are initially answered by our own admin staff and nursing staff on the ward, and are then passed on to whichever doctor is there or on call. So all of those staff are dealing with the advice line on top of their day-to-day work. So the money comes from people of Cornwall. Like the vast majority of our funding, the advice line is funded by our amazing supporters throughout Cornwall, which is, I find absolutely awesome. But also seems topsy-turvy for a service that's actually supporting NHS services throughout Cornwall. I am Cornwall Hospice Care.